Hello, ladies. Welcome to Wellness Wednesday. Hope you're having a great day. Make sure my ringer's off, volume's down. Let me just get connected real quick with my phone. I've had some issues getting, we didn't get a timer going today, so you guys were probably left in the dark just a little bit. Like, where is he? Okay, one second. Yeah, I hope everybody's had a great day. It's been a busy day for me. Um, Enough stress to cause some hair loss, right? Now, before I get into our topic tonight, I'm super excited about our upcoming masterclass starting August 18th and running through the 22nd. Every evening that week, same time as tonight, 7 p.m. Mountain Time, 6 Pacific, 8 Central, 9 Eastern. There's just so much to share, and I'll include bonus videos for extra information and tips. It'll happen right here in this group, just like tonight's Wellness Wednesday. And if I can swing it, we'll also have it in Zoom. And I'll tell you, joining live though through the group is the best way to get the most out of it. You'll connect with some amazing women who are dealing with similar challenges like fatigue, hair loss, brain fog, weight struggles. I mean, all of it, right? You'll also hear from others who have taken past classes or become patients and succeeded. And they'll share their experiences in the comments as they do so often. This group is so supportive, and being there live makes a big difference. Register to get reminders so you don't miss a session. And the registration link will be in the comments tonight for the here. All right. I do need to say my disclaimer. So everything that I share and say tonight is health information and is not specific health advice. Don't start taking, or change the way you're taking any of your medications. If you feel like you need to, please consult with the person who prescribes those for you. And by attending tonight's Wellness Wednesday, this does not establish a doctor-patient relationship. Tonight, I thought it would be very helpful to understand hair loss in women. All right. Did you know that around 20% of women experience genetic hair loss? So that seems rather high to me, and indeed, I think it is. So just know that that's a possibility. But I'm still a believer in epigenetics, right? And there may be some things we can do to even help with that. But I want to explain tonight to what causes the functional causes of hair loss in women, and why it's crucial to understand this, because it's a health indicator for one thing. You know, when it comes to why we experience hair loss, there are several things going on under the surface. It's quite a complex issue. And so it does indicate problems with health, which is not the absence of disease, but is the absence of proper function. So this is important as well to prevent this, progression of hair loss, especially if it's been going on for a while. And it's important to understand what's going on so that you know what you're looking for to get personalized treatment. Okay. And of course, there is an emotional and psychological impact for you ladies regarding your hair. This leads to self-esteem issues, self-image issues, mental health problems, even. For many, it's even tied to your identity, right? And femininity. All right. The fact that, your hair is so important, and knowing what's going on to cause the problem really should empower you to take control of what's going on. It gives, knowledge is power, right? And to help you reduce the hopelessness and the stigma sometimes associated, especially when there are medical conditions and it's not some, just knowing that it's not some cosmetic flaw, because it's often due to medical issues, functional causes. Even if a doctor hasn't given you a diagnosis of anything, that's honestly why I'm talking to you about it tonight, because so many times things are missed and you don't get diagnosed because your labs are normal. And anytime your labs are still within the normal range, your doctor tells you you're fine and there's no problem, there's no disease. And so you don't get to be treated for it. And it's like, well, shoot, what do you have to do to get some help, right? So understand that yes, there are medical issues, but there are functional issues going on. So there's no shame here, right? You can learn about these functional issues and be empowered, honestly. So we got to define it too. Did you know that it's normal for women to shed 50 to 100 hairs per day? Okay. Um, Hair loss is excessive when there's obvious thinning and bald patches for sure, right? And so there are different types of hair loss. There's a fancy word called telogen effluvium, which is diffuse shedding. There's androgenetic alopecia, so there's patterned hair loss, like we talked about in the beginning, 20% of women. Alopecia areata. Actually, I shouldn't say 20. Yeah, I guess I should. Yeah. Alopecia areata, which is patchy loss. Okay. And why should we, again, focus on these functional causes versus external factors? Okay. And so let me kind of go through these external factors, and there are many, right? So traction, what we call traction alopecia, from ponytails, if you're just used to always wearing a ponytail or braids or tight buns kind of thing. Over styling, right, can certainly lead to hair loss. Chemical damage or hair treatments, so bleaching, perms, dyeing your hair, or improper products, hair products. You want to avoid those that contain sulfates and parabens and alcohol, because they tend to dry out the hair. Environmental factors, certainly, like UV exposure, excessive UV exposure. Hard to say how much is excessive, but if you notice you're having a problem and you're out in the sun a lot, well, wear a hat. Try to protect your hair from the UV exposure. Pollution, hard water. So excessive calcium and magnesium in the water can certainly lead to problems with hair structure and maintenance. Scalp trauma, certainly, so injuries. Even like frequent friction from helmet wearing, if you're on a motorcycle a lot. I know you women are all on motorcycles a lot. Wearing headbands, things like this. Medications can certainly, and we'll go into this in a little more detail later. Lifestyle and grooming practices, right? Infrequent washing, aggressive brushing, overwashing, right? Depletes you of the oils that your scalp needs to help your follicles be healthy. Consider this. Consider that, a nutrient deficient scalp would make you more prone to these external causes. So some of the functional, considerations would be nutritional deficiencies, but the more deficient you are, the more these other things, these these uh, traumatic or, you know, chemical issue, causes would be, more severe causes for you. First of all, we want to talk about hormone imbalances as the first functional cause. Okay, so androgens, it's thought that elevated testosterone causes hair loss, but this is actually a myth that testosterone causes hair loss. I want to spend a little time here. Hair loss is complicated and it is not caused by testosterone or testosterone therapy. Now, men have more testosterone and lose more hair as they age, but testosterone doesn't cause their hair loss. Instead, a hormone called DHT, made from testosterone, is linked to hair loss in men, especially if they're genetically likely to lose their hair. Now, women can also lose hair in a similar pattern, but it's not because of testosterone, right? Things like stress, poor diet, certain medications, which I mentioned before, but we'll talk about some, health issues like thyroid problems or insulin resistance, common like PCOS or obesity, right, can lead to hair loss by increasing this DHT and affecting other hormones like the estrogen balance. And about 1 in 3 women lose hair as they get older, often when testosterone levels drop. Now, studies show that most women on testosterone therapy actually grow more hair, not less, right? Unless they have issues like with low iron, thyroid problems, obesity, higher body weight. So, testosterone therapy can actually help women grow scalp hair. So the problem is usually with estrogen fluctuations. So postpartum fluctuations, menopause, birth control changes affect hair growth, the hair growth phases and cycles, right? Um, and so you've got a growth phase and you've got a transition phase, and then you've got a rest phase and then a shedding phase. All right. So estrogen fluctuations start to mess with these phases and cycles of hair growth and maintenance. Thyroid dysfunction can certainly lead to hair loss. So hypothyroidism or hyperthyroidism caused by Graves, over medication, right, disrupt hair follicle health. Insulin resistance, this is now considered the most important cause of diffuse shedding, or this fancy term we learned, telogen effluvium. And the symptoms to watch out for certainly would be thinning hair at the crown, irregular periods or other hormonal signs, right? Okay, the next functional cause we need to talk about is nutritional deficiencies. So iron and ferritin, so low iron and ferritin levels are linked to hair thinning. This is very common in women due to, of course, heavy menstruation or vegan diets. Vitamin D deficiency, this is associated with autoimmune hair loss like alopecia areata. B vitamins, so missing biotin, missing B6, missing B12, especially the activated forms of these vitamins. So their role is very in strengthening the hair and the growth phases, is essential. All right. What about protein and essential fatty acids? Right? These are the building blocks for hair follicles. So if you're having trouble digesting protein, if you're not eating enough protein, if you're having if you've been taught to eat low fat and you're still following that recommendation from way back in the late 80s, early 90s, then you're missing building blocks. Some of the mechanisms for how these deficiencies, disrupt the follicle. Really, um, what happens is it prolongs mainly the shedding phase, um, and causes a jump from the transition to the shedding phase. A lot of you women in your search for thyroid answers, a lot of you've been participating in very restrictive diets, restricting a lot of nutrient dense foods like greens, really, hearty leafy greens and other vegetables. And some of you have gone, like we talked about earlier with vegan diets may have, prove troublesome with this hair issue, where you're not getting enough protein. So you've gone this route. You've been very restrictive. Maybe some of you are dealing with malabsorption, like celiac disease. You notice maybe the demands when you're pregnant has caused hair thinning and so forth. So these are risk factors that you've got to be aware of. So if you're still in the reproductive ages, and you're you know even breastfeeding, all right, can demand a whole lot more of your nutrients. And well, your brain prioritizes these things, your body prioritizes these things, and oftentimes your scalp is just the last priority to receive the nutrients that you're bringing into your body. So yeah, super restrictive diets aren't super helpful unless, um, I mean, in terms of restricting these nutrient dense foods. Okay. Let's talk about lifestyle, stress and lifestyle. Okay. And so stress is probably the most common inducer of hair loss. Okay. So this diffuse shedding, the telogen effluvium, can be caused by acute stress and chronic stress. Acute stress, like when you're sick, you've had surgery, you've dealt with a major emotional trauma, something like this. This pushes hair follicles into the resting phase faster. And that's when the shedding begins. All right. So cortisol pushes you into it's called the telogen phase sooner. That's the resting phase. Fight or flight, where you're producing, not just cortisol, but these other stress hormones, restrict blood flow to the scalp. So that will lead to diffuse shedding, especially during brushing and washing, because you're not able to deliver the nutrients through the blood flow to the scalp. Okay. And then with chronic stress that elevates cortisol, this disrupts hair growth too, because it shunts it. Look, cortisol prioritizes energy allocation, right? Nutrient allocation to vital organs. So it reduces nutrient availability to non-essential tissues like your hair follicles. You can live without these, right? These hair follicles. And so you end up with a nutrient poor scalp. And this leads to brittle hair. So a brittle means a nutrient deprived scalp, essentially, right? So chronic stress also increases the androgens, but remember, if it's mainly when it converts to DHT that is the main issue, and that doesn't happen as much in women. But in the small percentage that we talked about with genetic hair loss, that is more common to produce more DHT, that androgen, that particular androgen, instead of actual testosterone. And then, of course, it decreases estrogens. Chronic stress decreases estrogens and then suppresses thyroid function. So these will all contribute, these hormonal imbalances will contribute to um, hair thinning and hair loss. Some other lifestyle factors to consider: poor sleep, right? Over exercise. Uh, I know not a lot of you do, but might be some smokers, right? Smoking affects scalp circulation and therefore nutrient delivery. And some other stressors, of course, to consider. And this is a very broad kind of, you know, stroke that I'll paint here with, but childbirth, childbearing, childbirth, just illness, right? So especially we heard of COVID causing a lot of hair loss, surgeries, detox. When you're going through, some of you who are patients going through detox can be a significant enough stress to shunt nutrients away from your scalp. Chronic anxiety for sure, and certainly other emotional stressors, right? And trauma, right? Definitely. So stress management techniques are really going to be important. Mindfulness, yoga, meditation, prioritizing sleep is huge. Making sure that you are getting to bed earlier and allowing for more sleep, and then seeking therapy, if needed. Um, let's talk about some medical and autoimmune factors here now. So first of all, autoimmunity. Alopecia areata is when the immune system is literally attacking hair follicles. So causing this causes patchy loss. And so we'll talk a lot about this during the master class, some of the triggers, the triggers, a lot of the triggers for autoimmune disease, because part of discussing thyroid conditions has to include a discussion about autoimmunity. And so we'll discuss all these sorts of triggers, the things that fuel the autoimmune fire that will cause the immune system to, in this case, attack the hair follicles. Lupus can certainly lead to decreased scalp health. Other autoimmune diseases as well. Yeah, there's many different things. So medications, side effects of drugs, chemotherapy, that's pretty common. You hear about that a lot. But what about antidepressants, right? Or beta blockers, anticoagulants, so blood thinners. Beta blockers, ladies, are used for heart rate control when you have palpitations. They're used for blood pressure control. They're used for heart failure, although they really shouldn't be, looking at the recent research about that. So these medications, hair loss is a common side effect. Let's see, other things, other conditions, medical conditions. So scalp infections, parasites, fungal infections. Then you've got conditions like chronic conditions like diabetes. So we talked about, thyroid as well. We talked about that and how those, affect hair growth. It's important to get the right blood testing, complete thyroid panels and androgen levels, hormone levels. Testing for insulin resistance and blood glucose issues is so important. This is what is going to really help us to dig deeper and find these functional causes for you. Certainly, other mechanisms are involved. Inflammation, so cytokines. You may have heard that term, specifically IL-6 and TNF alpha, tissue necrosis factor alpha, are particularly known to interfere with follicle function, hair follicle function. Immune dysregulation can disrupt follicle function as well. That can be caused by low MSH, melanocyte stimulating hormone, and other toxins that are produced by bacteria. So certain just not that you have a scalp infection, but other infections like chronic sinus infections with particular bacteria that produce a lot of toxins. Uh, so it's important to really get an early diagnosis, and you may need help of dermatology to do, biopsies. But even before you get that far, um, we've got to do some evaluation, right? So for some extensive tests, functional testing, and then that really opens up treatment options. And it's important to track your hair loss patterns, um, and other associated symptoms, fatigue and irregular periods. Other lifestyle factors are important as well. Like we talked about the mechanical kind of factors. So, um, there really are a lot of things that can be done from a holistic, functional approach. All right, including dietary changes, stress management techniques. But keep in mind, medical interventions may be warranted. So when would you want to see maybe a specialist about this? When you have persistent or severe hair loss, rapid onset hair loss, when it's just all of a sudden, other accompanying symptoms like joint pains, fevers, right? But I'll be honest, you will still need what I term comprehensive testing to really get to the root causes. A lot of times these are missed because they're only testing certain things. Even specialists, they still only check certain things, certain tests that are covered by insurance, leaving a whole lot of others unchecked. And you need to have these complete panels checked. Some other considerations as I finish up and give a few success stories. Um, the timing for hair loss is, from stress. Uh, it often appears 2 to 3 months after the stressor due to simply the hair cycle's delay. It makes it hard to link it directly with stress without really real proper tracking. Um, and some other compounding factors. Stress often interacts with other things, right? Like poor diet. We talked about nutrient deficiencies, sleep deprivation. So working night shifts, amplifying this kinds of things, these kinds of things certainly amplify hair loss. That's what I'm trying to say. Um, and so gosh, overeating or restrictive diets can worsen these nutrient deficiencies. And and like I said at the beginning, I know we have to consider the prevalence of genetic hair loss with women, but when it comes to some of these factors that would make things worse for that particular woman with that, certainly knowing these functional aspects can have an epigenetic effect, meaning your environment affects your genes, right? And so if you can control, because what you're really trying to be careful about in your environment, um, you will be better able to control how your genes manifest. All right, that's what epigenetics is. All right, so kind of a quick recap of, is, there are hormonal, nutritional, stress related medical causes, functional causes of this hair loss, this hair thinning. Okay. And and so it's so important to take, proactive steps to finding out what is causing this. Most stress related hair loss, ladies, is reversible with stress reduction. That's the good news. It's reversible with the proper lifestyle changes, with addressing coexisting deficiencies and other causes, infections and chronic medical conditions that can be addressed with a functional approach. Um, Chronic stress can lead to alopecia areata, or androgenetic alopecia. But remember, if we, stress can be mitigated. It does act as a multifaceted driver of hair loss because it can disrupt the hair cycle, hair cycles. It can trigger inflammation, depleting nutrients. It can alter hormones, but addressing it holistically can mitigate its impact, certainly, and support hair regrowth. I've had lots of patients be able to, you know, to succeed with this. This requires getting to the root causes through comprehensive testing and having a comprehensive diagnosis from someone who knows how to put all that testing together and to guide you through the process. Okay. Um, Michelle was one of my dear patients who was really noticing thinning hair, very, very thin on top. She had major skin issues. She had major parasites. And so when we treated those things, her hair grew back in thick and curly. It wasn't curly before. She was shocked. Stacia had a problem with real thinning hair, and she, worked a real stressful job. Uh, we found she had autoimmune thyroid issues. So with getting to the bottom of that with comprehensive testing and helping her with stress management, helping her go through a comprehensive treatment plan, um, her hair actually started thickening up nicely, and she's doing well with that. Lily, another patient, she had some pretty acute stress. Okay, she lost her husband and went through a lot of grief and stress because she had some young boys, and so she found she had a thyroid issue as she went through the comprehensive testing and nutrient deficiencies, several, and she was successful in getting through that, getting help for the grief and stress management, and she was able to notice successful hair regrowth. So uh, there's hope. Please have hope. Thought I'd take a few questions and see what you guys uh, need help with. I'll take like I said, a few questions. Let me get to my. Okay, so um, what about when you wash your hair and it comes out in clumps? Well, yeah, I mean, that's because there are these factors that we were talking about. Um, there's nutritional factors, medical, potential medical issues. Um, there's, nutrient deficiencies, stress. And so then these cause even more of a problem when you're actually working with your hair, right? Washing it, brushing it, and it leads to, more hair loss. Is there a link between hair loss and poor fingernails? Absolutely, because that speaks to nutrient deficiencies. Um, so yes, the hair and skin all dependent on collagen. So protein deficiencies would be something to look for, and so many other those vitamin nutrient deficiencies, um, fatty acid deficiencies as well. Your skin, your nails need proper fatty acids. What are cytokines? Cytokines are little inflammatory, they're the body's inflammatory messengers. So when there's something that's, bothering us, whether it's an infection or toxins or, an injury or, our cells release these messengers to alert other cells that there's something going on. And it's part of the mechanism to help protect the other cells. And so the cells kind of go into, you know, um, it's actually called cell danger response, and these chemical messengers mitigate, or that's not the right word, are part of that communication process in and among our cells and our tissues. Let's see. Um, yeah. So Patricia, I'm Cherian shared your comment, and it's important to understand that detoxification is an important stressor to consider when dealing with maybe increased hair loss as you go through sometimes this process. When we know detoxing is so important because we've got to get these toxins out, they've got to come out. When you guys have genetics that don't allow the toxins to come out, um, we've got to go through that process. So for some of you, unfortunately, you might notice worsening, thinning than, as you go through that before it gets better. But once the stress is over, the stress of detox is over, then you should be able to rebound and regrow. Okay. How can I get your comprehensive testing? Can it help me with my hair loss? So the most important thing for you to get comprehensive testing is attend the master class, because it's during the master class that I can uh, open up some opportunity, the opportunity for you to get comprehensive testing, and I explain what that is during the class. So I encourage you to attend, register, and attend, and you'll have an opportunity for that. I was told by my internal medicine doctor that I can't take anything with biotin before blood work. Is this true? Oh, that's just for a few days. That just so biotin does affect the TSH test. It's the actual test done at the lab. It doesn't mean you can't take it, and it doesn't do anything else. It just interferes with that particular test. So if there's a lot of biotin in your blood, it might not register correctly in the test. It's just for a few days prior to getting your testing done. And I would say the same thing. So, all right. I don't see any other questions. I don't forget to register for the masterclass, right? That way you get reminders, um, and try to remember to participate live as much as you can. Take some time to attend. I mean, make it a priority. If you're stuck and you're feeling, um, well, that's the word. I mean, stuck is the right word. Um, and whatever, okay, I see that question. If you've had your thyroid removed, is this master class for me as well? Absolutely, because if you're still having symptoms, fatigue, this hair loss, um, you know, uh, brain fog, pain, any kind of pain, joint pain, um, muscle pain. If you're having digestive issues, if you're because those are often due to low thyroid. If you're having um, any sort of brain fog or cognitive issues, memory issues, depression, anxiety, if you still have those symptoms, which are supposed to be helped with thyroid, then something else is going on. Or your thyroid's not being properly managed because they're not getting complete testing. And this is something I explain in depth during the masterclass. You really don't want to miss it. Even if you don't have your thyroid and you're on, um, thyroid replacement hormones, 80% of the time, the synthetic hormones do nothing, don't do enough to help. And so you've got to find out, well, why is that? What are your root causes for why you're not feeling the way you need to be feeling? Well, there is another question. Can gluten be a trigger? Absolutely, because, oh, and I go into great detail on that too. That's a whole topic in and of itself. Um, yes, gluten can be a trigger because it's hard to digest. It's full of fructose. There's lots of information on that we'll go through. Yep. And that the fructose raises your blood sugar and raises the insulin, makes you more insulin resistant. Woo. whole lot of information to go through there. Very good, ladies. Thank you for attending tonight. You asked some great questions. Keep them coming. We're going to do a live Q&A at the end of the master class. So as you think of questions as you go through the class, we're going to compile all those and do a Q&A, which is so often one of the most popular sessions. Okay, so you're going to get so many answers going through this class. So register, don't forget, and put it on your calendar. Set reminders in your phone so that for the time zone you're in, right? 7 p.m. Mountain, 6 Pacific, 8 Central, and 9 Eastern time. Each evening that week, the 18th through the 22nd. All right, ladies, thanks for attending Wellness Wednesday. Remember that there are answers. Please have hope, and you still have the power to heal. Take care and have a great night.